Hi guys, welcome to Dr. Kids channel. I'm a practicing pediatrician, have a master degree in pediatrics, and basically what this channel is all about is, as my practice is growing, I have come to realize that many parents are usually getting panicked for so many small childhood illnesses and immediately go rushing to a doctor, search of a doctor in the middle of the night, and they are this channel is basically to explain the common childhood illnesses in common language so that they need not get panicked for things so minor such as a fever. So everybody thinks fever is an emergency. Actually, is fever an emergency? No. So to have an idea about fever, I'll tell you three things. So the first thing is the blood. So the blood temperature is sensed by a center in the brain. So whenever the blood gets warmer, the center in the brain will regulate the blood temperature. Whenever the blood gets warmer, the center in the brain will decrease the blood temperature, and whenever it gets colder, it increases the blood temperature. This is the duty of the center in the brain. The other thing to know is the blood vessels in the skin. Whenever the skin temperature is warmer, it redirects the blood from the skin to the other organs, and whenever the skin temperature is colder, they'll receive more blood so that the skin will become warmer. So the warm skin is basically what everybody touches and feels as a fever. So this is how the body immediately sensitizes or senses the temperature and immediately regulates it on its own. This is normal physiological response to colder or warmer temperature in the body. So this is what every parent or everybody will feel like fever on day one when you touch the child or when you record the temperature. So the other idea is to know whether the fever can be a normal variation in a child. Yes, suddenly you come home and you touch your child, and immediately you will feel a sense of warmth in your child, and immediately you will think that, oh, he has gone to school and come now with temperature. He has some infection or some sort. We have to go immediately to a doctor. No, there is no need to panic. So every child or everybody will have a diurnal variation, that is evening time the temperature can rise up to 100.3 degree Fahrenheit. So when you touch the child, record the temperature. If it is above 100.3 or if it is just on 100.3, just wait for an hour or two so that the body does its own physiological thing and reduces the temperature. So on day one of fever, the basic idea and take home messages: do not get panicked on day one of fever. Even the temperature is around 103 or 104, nothing is going to happen to your child. And in the subsequent videos, I'll try to explain what are all the causes of fever and what are the practical things you should do when in a fever. Do like and subscribe and share my channel.